Uganda's healthcare sector presents a stark contrast between a heavy, evolving disease burden and a severely constrained public health budget. The over 45 million population poses a growing demand for healthcare services. However, government funding remains significantly below both international targets and national operational requirements. Uganda allocates between 6% and 8% of its annual budget to the health sector, falling far short of its 15% commitment set by the African Union Abuja Declaration.
Thank you so much.
In the financial year 2025-2026, the health sector received a historic allocation of 5.87 trillion shillings, which later reduced to 5.23 trillion shillings for the current financial year 2026-2027. Mulago National Referral Hospital is the face of Uganda's healthcare, and currently it is referred to as Mulago National Specialized Hospital. Hope to many at the verge of dying and others rehabilitating their lives. The numbers are getting overwhelming. The hospital faces staff shortage averaging at 43%, yet burdened by referrals from across the country, according to the Auditor General. It is operating with 1,327 staff, way below the required 2,334 personnel.
You reach a point in time whereby you need the care and the nurses don't care.
This week, Fixing Uganda is in the intensive care unit. We look at the state and the status of the ICUs in the national referral hospitals, regional referrals, and the general hospitals, and the glaring health gaps.
You have a patient who needs probably oxygen, and they tell you that the cylinders have no oxygen. They go bring a cylinder, it has no oxygen. But remember, this patient is fighting for their life.
Mulago Specialized National Referral Hospital has a bed capacity of 44 under the intensive care unit. 27 beds are under the adult ICU center, 2 in the organ transplant unit, and 15 pediatric ICU specialized to children health needs. While the number is sounding, admission has been conditioned to availability of an ICU bed. But is it just the physical bed?
The total bed capacity for this unit is 27, but we are only able to admit 12 patients. Yes, so admitting a patient depends on the availability of space. If there is no space, then we cannot admit the patient here in ICU.
Marcel Obongonyinye is a father and husband to a young family. His firstborn child, Carlton, is a registered mortality at the Mulago National Referral Hospital. He needed critical care, but 2 questions are looming. Is it resources or laxity?
When they told me that we need to take this boy to ICU, the follow-up statement was, but it's 200K. I'm like, it is okay. They're like, okay, let us go and prepare. The doctor comes back and says, there is no bed in the ICU. So in that process, we start saying, okay, what do we do? Should we look for options outside the facility? Said, okay. So my wife makes phone calls. I also make a few phone calls. I call. There's one hospital I was referred to. They tell me, you need to pay 5 million before entry. Said, okay. Then my wife says, no. We have a facility. They are ready for us. I've already talked to them, so we need to evacuate the patient to that hospital. Then they tell me, okay, we have an ambulance, but it has no driver.
This condition is biting, and it's deeply biting. For a parent, it's even more devastating. Exchange from one cylinder to another. But how much could life hold on until it vanishes?
But in that moment, his heart, for me, I was just waiting for them to tell me, you know what? He's not made it. Then he comes back with another cylinder. It had the oxygen, so they put him, I push him. That's now about midnight. At about 2 a.m., the doctor walks out. He tells me, Daddy Carlton, we are trying, but I don't know if you will make it. Yeah? Then he tells me that even the machine that we are using has run out of oxygen. So we are using CPR.
The Auditor General's report for 2025 details functionality of the intensive care unit and theatre equipment. It states, for the last 5 years, Uganda has delivered ICU equipment to 15 regional VAR hospitals, 3 national VAR hospitals and 7 general hospitals worth 150 billion shillings. This included heating, ventilation and air conditioning systems for ICU and critical care equipment for newborn ICU operations. The Auditor General rather confirmed a worrying state: unreliable power supply, non-functional diagnostics equipment, inadequate oxygen supply and inadequate maintenance budget. For any intensive care unit, the World Health Organization guidelines recommend that the ratio of a patient to nurse has to be 1:1. 1 nurse, 1 patient. And in some circumstances where it is more critical, it has to be 2 nurses per patient. In Uganda, that continues to be different. 1 nurse could be required to deal with 4 patients at any instance. That is the setup of the critical care in Uganda, and that remains to be the bigger question. How is the healthcare unit in Uganda? How exactly is the intensive care unit in Uganda?
Because even those 12 patients, you may find I have only 3 nurses in a shift. So if you divide 12 patients among 3 nurses, that means that each nurse is handling 4 ventilated patients. So just look at it, that this nurse is not at the patient bedside at all the times, because she has to do this bed for some time, then go to the next one, go to the next one. By the time she comes back to the first one where she started from, you may find maybe eventuality has already happened in this patient, because she's not constant on the patient. She's manning 4 patients at a particular time.
You can receive 10 consults in the day for 1 bed. So you have to determine, of all the 10, who is likely to benefit for that 1 bed. And that is the person whom we shall pick and take on.
An audit covering 16 regional referral hospitals and 5 national referral hospitals revealed acute personnel shortages exceeding 90% across all critical care cadres. Specialist positions such as principal nursing officers in critical care suffer from 100% vacancy rate, while senior consultant intensivists face a 95% deficit, with only 1 post filled out of 20 approved positions. Across all specialist care roles, hundreds of key medical and nursing positions remain unfilled.
We need to get to the root cause of what is happening. People are there outside trained to come and